Well, today is Valentine's Day, and it's all about heart. And with February being Heart Month, today is a great time to start thinking about ways to stay heart healthy. And joining us this morning with some tips for women is Dr. Kristen Andresen. Good morning.
Good morning. Thank you for having me.
Well, thank you for joining us. First off, why don't you tell me how many women have a heart disease compared to men?
Women have heart disease. About 34% of women in the United States are living with heart disease. And up to 1 in 2 are at risk for developing heart disease in the future. That's why it's such a significant problem.
And what are some of the signs that women might experience if they don't know they have heart disease?
Women are prone to being atypical in presenting with heart disease. Sometimes they present with fatigue, shortness of breath, as opposed to classic chest pain.
And if somebody were to have, a heart disease or a heart problem, what should they do?
Certainly they should contact their provider. Certainly anybody with having any type of chest pain ought to call emergency 911. Shortness of breath, fatigue, arm pain, jaw pain, back pain, these are a lot of the atypical symptoms that women may present with. I believe if patients want to know their risk, they ought to see their providers. Gundersen Lutheran has a program for women specifically to help them identify their heart risks and educate them regarding their lifetime risk of heart disease and what they can do to help prevent it.
And heart disease obviously isn't just a problem for women, it's also a problem for men as well. And there are ways to detect it in men also.
Oh, for sure. The mechanism or the disease process is the same. It's just the way they present is slightly different. Certainly, women typically present older. Men are typically younger. Women are more likely to die of their disease because they are older, and at that time they have more medical problems. Men, too, should know their heart risk. Classic risk factors include hypertension, diabetes, smoking, high cholesterol, and family history. So if anyone has a family history of heart disease, I strongly recommend they get evaluated and understand their heart risk.
And when it comes to heart disease, I know a lot of people think of open heart surgery and that kind of surgery. Is that the cure for all heart disease or illnesses?
No, it's not a cure, but it helps improve blood flow to the heart. And that's a very, well-known procedure, very effective. We have wonderful surgeons here at Gundersen that have a great track record. That is, a good way to have people have a treatment for their heart disease, but it doesn't cure the underlying process. The underlying process takes risk factor management and aggressive lifestyle changes.
All right, well, thanks for joining us this morning, Doctor.
Thank you. Thank you for having me.